Hey everybody, it's Dr. Mary Trumpi, and I'm here answering your questions off of TikTok. So sometimes when you have cracking noises when you move a joint, as long as it's not associated with pain, often it's something like a tendon or a ligament that should be living, for example, in a little bit of a groove like this. So if maybe something's not properly aligned, you have a little bit of tightness or inflammation, sometimes when you move it can just flick across a piece of the bone like that. So if you move your arms, move your knees, things click, something's not quite in position, it's usually a tendon or ligament that's flicking over a piece of the bone, like a bony prominence. So the side effects to chiropractic is you will feel more aligned, you will feel looser, you will feel, many people see they actually feel a little bit more clear in their head, and when I adjust their neck, they stand up and say, I feel clearer, my eyes are brighter, and it's usually all good side effects. Really depends on each person individually. Of course, extremity issues, ankles, knees, shoulders, adjusting the spine just helps, but if you really have a neck or a back issue, it just depends on how long you've had the pain, how severe is the pain, and our long-term goals. So it could be as often as once a week for a month, or some people actually go a couple times a week to get in proper alignment, stay in alignment, and help your body hold the adjustment. So in addition to neck pain, back pain, headaches, chiropractic can be very helpful for sometimes digestive issues. The nerves that go to digestion come out of mid-back. If you happen to be a person who's sitting at a desk too much with forward flexion, it can put pressure on the nerves that go to digestion, headaches, energy, muscle tightness, muscle spasms. So when you get a chiropractic adjustment and they open up the joint, what actually happens is a little bit of a nitrogen gas is between the joints, and when you open it, the gas escapes, makes a noise. For example, if this was one bone and this was the other bone in your spine and you adjust it, there's actually 4 points of contact on each joint. So you could adjust one joint and have 4, 8 sounds. Some people's spine don't make a lot of noise. Sometimes it depends on the size of the vertebrae, the tight surrounding muscles, but you don't always have to have a sound. It's just very satisfying. The stomach gets a little bit bigger and the center of gravity changes every 2-3 weeks. You go forward, 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 pressure on the back, neck comes back. So getting adjusted keeps a lot of the pressure out of there and helps you kind of deal with the modifications as your body's changing as well. If you're having knee pain you don't really know why it's coming, but you're exercising, you've got to keep the outsides of your legs and your IT bands as loose as possible, especially if you go from sitting, exercising. It's strength and it's more about flexibility and lengthening of the IT band and the muscles that all go through the knee here. And if you can keep those lower, less tight, that will help on the knee tracking. If you're having a lot of knee pain, I suggest to avoid leg extensions for a couple, 2-3 weeks. If you're having pain every time you're doing a leg extension on a machine, then you need to not do that exercise. A rule of thumb for knee pain and a lot of other injuries, if it hurts when you're doing an exercise, you got to stop doing that exercise until the pain goes away. Don't work through it. It's not going to make it better. Best exercise for low back. It depends on the severity. If someone has a bad low back, but they train a lot and they want to train heavy, and they want to keep doing deadlifts and squats, but their back becomes quite severe in pain afterwards, you got to modify that movement. If you have a fragile back, you need to do something supported. You can't just go bend and do bend over rows if you have a back that's temperamental, okay? Do something with a pad. Do the dumbbells where you're leaning maybe into an incline. And I'm not saying you shouldn't do deadlifts. In fact, I love deadlifts, but forward flexion means this. Weight load bearing is weight in front. So no matter how good a form you do, it's gonna go to your low back and L5-S1. So be cautious on deadlifts. Even if you want to do them, try to do some modifications if your low back hurts. Localized cryotherapy is similar to the full body machine that you get in that does full body cryo. Localized cryotherapy is a handheld device that actually delivers a very nitrogen-cooled stream of air specifically to an area that's in pain, inflamed, there's swelling. What it does, it's so cold, it drives, let's say my wrist hurt, right? You would aim the beam right here, very, very cool air. What it does, it stops pain, inflammation. Then when you remove the very cold air, fresh blood rushes back in, bringing oxygen to the tissues to help you heal. It's not dangerous, no. You would just not want to have it too close, and the machine is built in with 2 lasers that tells you exactly how close to get to the skin. It wouldn't really freeze you or burn you, but you would just, just be cautious on who's applying it to you. One thing you would not want, you do not want to do localized cryo on an area of your skin that is wet. So no sweating, no post-exercise. Make sure it's dry because it might burn the skin. You know what? I think optimally, if you can handle an ice bath, that is probably beats any cryo, localized or full body, just because it's, I think you can get the same temperature. I would suggest getting your cryotherapy post-exercise, just because you may, you maybe get some inflammation, especially if you have an injury, and blood flow, exercise, cool it all down, help you recover. You should probably get a cryotherapy at least, if you have an injury, once or twice a week per body part. And one of the things that people might not know, okay, so I do chiropractic, okay? So it's chiropractic, okay? Cryo actually comes from, I think, a Latin term that means hand, okay? So that's how we were taught, that's what chiropractic means. Now, what we're doing in back is cryotherapy, which is the difference, okay? This is what I do to people with my hands. Cryotherapy is the handheld device that cold, delivers the cold air for recovery, okay? So some people know they're like, chiropractic, they don't know how to pronounce that, so this is the therapy, and this is chiropractic.